Welcome back to Atlanta and Company. I'm Christine Pilara. So great to be with you on this Monday. It's not a well-known million Americans are suffering from peripheral neuropathy right now, and many more cases are undiagnosed. The leading peripheral neuropathy doctor in the Southeast is with us to explain how technology, not pills, is revolutionizing the treatment for this debilitating condition. Dr. Matthew DiDuro of the Atlanta Pain Institute joins us now, along with two of his patients, Jack Etter and Mary Edenfield. Welcome to you all. Thank you so much for being here. Welcome back, Doctor.
Thank you for having us.
Well, for anybody out there who's saying, what is that? I've never heard of it, and so many people are suffering from it. What exactly is neuropathy?
Neuropathy is a disease process to the peripheral nerves of the body. So it affects hands and feet. They call it glove and stocking type distribution. So that's what it is. It's a condition that's progressive and oftentimes debilitating.
Now, we mentioned in the introduction that you have a different kind of therapy as far as treatment goes. So how does it work? Why is it different?
We use low-level lasers and infrared light technology. It's real science, real technology that helps increase blood supply to the feet and hands by almost 400%.
Wonderful.
So it helps open up those small little capillaries and allows blood to kind of get down to that tissue. So it's a nerve issue, but it's also a devascularization issue. So it really helps increase the blood supply. And the nice thing is we can put the pads and the laser boots right on the areas that are being affected.
Oh, that's wonderful. Who does it primarily affect?
Well, it affects many people with diabetes, also with small fiber neuropathy, people who have been on statin-type drugs, and then also patients who've had low back surgery or chemotherapy sessions.
Okay, I still can't believe that 50 million Americans, and I wasn't that familiar with the condition. And there's some new research that has come out. Tell us a little bit about that.
Right. As you know, my brother is the founder and president of Neuropathy Treatment Centers of America. We started researching this after my mom came down with this issue back in 1998. So she was on statin meds, and that's what kind of caused her problems. But the technology and the science has come a long way. The research that we just presented at the Pain Week conference out in Las Vegas in September showed that we're improving nerve regeneration by over 300% to the affected areas.
That's fabulous.
So we're excited about it.
Yeah.
And they can look on our website, freemypainnow.com. There's a research paper section, and you can download any of those papers.
Okay, terrific. And now let's turn to you guys. Jack, you came to Dr. DiDuro with diabetic peripheral neuropathy. Explain what that was like living with and how he's helped.
Well, very simply, I couldn't feel my feet.
Oh, my goodness.
Or my hands. It was affecting me because the doctors many years ago put me on statins. I've been a type 2 diabetic for 25 years. And they had me on statins from cholesterol levels. And the statins brought upon the peripheral neuropathy. And I could touch my feet, and they were totally numb. All the way up almost to the ankles. And my hands, my fingers were numb. Plus I had pain. I had, pain at night, sticking pain in my feet and sometimes my hands. And I went on Dr. DiDuro's program. I had my 20 treatments, and I think my test scores for the neuropathy improved from like 30% to 90% after 20 treatments.
That's incredible, and I think we have some before and after pictures to show. So tell us about how it's helped your life just get better, your quality of life.
Well, number one, I don't have the fear of losing my feet or my hands.
Right.
And that fear alone is very, very scary.
Sure.
And the quality of my life is improved because I can walk better. I have feeling. It's just, it is definitely an improvement. Okay.
That's fabulous.
There's no question about it.
And Mary, you suffer from severe restless leg syndrome. So tell me about that and how their clinic helped.
Well, I am a retired school teacher, and being on my feet, about a year ago, I began to realize that my legs would just tingle and like little needles stick in them. And also I would have cramps, even from my toes all
Oh,
the
I
way
hate
up
that.
to my thigh. And that would be at nighttime. And of course, I wasn't getting a full night's rest because it would wake me up several times during the night.
Right.
And I'd have to get up and move or put warm cloths and all on it just to get the cramps to go away. And when I started Dr. DiDuro's treatment, I wasn't real sure about it. And I said, well, I'm willing to give it a try because I wanted to be able to walk. I have 3 small grandchildren, and I want to be able to
chase after them. Yeah.
chase after them and walk with them and have fun with them and play with them. And once I started the treatments, amazingly, the treatments at this point in time, I don't have any cramps. Because at one point I was not able to wear my heels to church on Sunday. I can wear my heels and still not have cramps or the deadness or the tingling in my legs.
Just feeling like your old self then.
Yes, and I can even run and play chase with my grandchildren. And
that's the best
it's
part,
wonderful.
I imagine.
It is.
That is terrific. And Dr. DiDuro, talk a little bit about the Neuropathy Relief Program. What's that about?
Well, it's a protocol that we put together, and Mary, she noticed after one session. That's not very common, but she knew after coming in. What we do is
it was working, huh?
Yes.
She knew, and the neuropathy treatment program is really there's 60% of it is just kind of getting into our office, getting into the boots. The other 40% comes from their home therapy program.
Right.
So, she was very disciplined, both of them were, at doing their home therapies and getting into their visits and making it work. So.
Right. I mean, there's just so much you can do, but then when you're not in his office, you have to do the right things, and
Right.
clearly you did, and it's showing. That's
help maintain
terrific.
it, yep.
And you have a special for Atlanta and Company viewers?
Well, yes, for the first 25 qualified callers, we have a special for $47. We're offering our advanced neurofoot exam and comprehensive analysis. And also, we're going to do a cardiac assessment screening as well.
Wonderful.
For those first 25 callers. And remember, this doesn't help everyone.
Right.
We pre-qualify you because we want to find out oftentimes how long they've had the issue,
Sure.
the iteology behind it, and those type of things will kind of determine if they're a candidate. As I said on one of the last shows, the central nervous system, the brain, and spinal cord are like the trunk of a tree. And the branches that kind of branch off into our hands and feet, those are like those large branches. So we're testing how strong and the integrity of those branches. A weak branch still grows leaves,
Sure.
a dead branch grows no leaves. So we can't work with people with dead branches.
Okay, but you have the opportunity to get the help that you need. Doctor, thank you so much. Thank you to you both for taking the time to come on. I know people love to hear this story, especially if they're suffering from the same thing, so thank you. And if you would like to take advantage of Neuropathy Treatment Center's generous offer or to find out more, simply call 855-ATL-FREE. That's 855-285-3733 or log on to freemypainnow.com. And this segment was paid for by Neuropathy Treatment Centers of Atlanta.